those houses are not properly remediated, and proper remediation, I don't know if we actually understand fully how to do that when a catastrophic event like Harvey happens. You have to exclude the mold completely, and if you do not, then you trap the mold in the house as you repair, and then that mold becomes a health hazard for anybody that lives in that house. And again, those houses will be around for decades after they're improperly remediated, and so this will be a problem for decades on into the future.
Well, you mentioned something short-term and long-term. Right. Short-term, what are we talking about?
The short-term, we have this, for folks that have never been through a hurricane and have been through this kind of flooding, it's hard to understand what's happening in Houston right now. But the houses, the tens of thousands that have been, damaged, in front of each of those houses is a gigantic pile of moldering organic matter, including carpets and drywall, wood, and that kind of thing. And that is an enormous biohazard right there in front of every one of these tens of thousands of houses. The city, I'm not criticizing the city. The city is doing everything they can to try to clean this kind of thing up, but it's going to take time. It might be months before the rest of this is cleaned up. In the meantime, even for folks that are living in these neighborhoods that were not flooded, they're having a lot of trouble. Some of these guys have pre-existing, serious allergic disease like asthma, and I can tell you for sure because I've been seeing these guys in my own practice at the Veterans Hospital here in Houston. Mm-hmm. They're coming in with horrific exacerbations of their disease, and we're trying to catch up and get them back into some sort of a reasonable health status.
And you're talking post-Harvey.
This is post-Harvey, right? Immediately post-Harvey.
I was going to say it was that quick.
It's that quick. That's how fast mold grows. And then once it's grown, it's very, very hard to get rid of it. So you can remove these piles of trash, but you got to understand that the same thing is happening inside these houses. And so how do you get rid of, you can't get rid of the house, so, or most cases you can't do that. So how do you remediate that house to get rid of that mold so the house is now safe to live in for the long run? There's no good answers to this. There's no good engineering solutions that everybody agrees on. So this is the problem that we have. The main problem for the long run.
So for individuals who are susceptible and individuals who suffer from this, what can we do? We can't fix everything that's a problem around our city right now. So what can we do?
So the most that you can do is try to get rid of these piles of trash as best as you can. Most folks are going to have to rely on the city, of course, to do this. If your house was flooded, try to get it remediated as best as you possibly can with the most skilled and experienced contractors and builders that you can. In terms of controlling the symptoms, there's over-the-counter antihistamines and nasal sprays that can certainly help. But it's people that have more serious symptoms, for example, shortness of breath or evidence of sinusitis, headaches, and maybe cloudy secretions coming from the nose, probably need a trip to a specialist, probably an allergist or a lung specialist. Who can advise them further, do the testing that is necessary to understand fully what their problem is, and then treat that accordingly.
Do you have time to take a few questions if we
have
them?
Absolutely.
Are there questions?
Yes. Christella, she says, I was just wondering why I'm having awful allergies right now. Shortness of breath is terrible. What can she do about that?
Sounds like that might be some asthma coming up. If that may be, I don't know if that's a new thing or if that's an old problem, but it does sound like asthma, and that certainly is one of the more serious complications of allergies, certainly that we worry about. Again, there's really not much over the counter that you can buy for asthma. It really needs a trip to a specialist, internal medicine specialist or pediatrician. I'm not sure where you're coming from, but somebody who is experienced in diagnosing and treating asthma. That could be an allergist, it could be a pulmonologist.
Okay, Mary's saying that's why my baby has been sick from all the debris. Are you hearing more and more about babies having issues with allergies?
So yes, so it's folks across the age spectrum, from infants to children to adults to senior citizens. I work in strictly an adult practice, but I can tell you that we're seeing a lot of adults coming in with exacerbations, worsening of their baseline disease. It's very frustrating. We get people in good shape, and then now we're seeing a lot of them getting deteriorating at a very fast rate.
Okay, Lena says my allergies have been so bad, and I don't even have allergies. So are you seeing a lot of individuals just getting post-Harvey related allergies?
So absolutely. So folks that have really never had much in the way of disease, we're now seeing that new kind of patient coming into the clinic. So that's very much true. So lot more new disease and a lot of exacerbating old disease is what we're seeing.
I'm trying to figure out, though, if you don't live in an area where there was, and thankfully for those who don't live in areas where there was the disaster and were flooded, how far out does it affect people? Do you know what I'm asking? From those particular neighborhoods? Because we're talking as Houston as a whole, and it seems to affect pretty much everyone in our area.
Right.
How far out are we talking?
Yes, that's a good question. There's really not great statistics on that, but I think it's reasonable to assume that it's basically an onion effect. So the closer you are to the directly flooded homes with all those piles of trash, the very worst epicenter, if you will. But anywhere where the flooding happened, it doesn't even have to involve houses, just the flooding of open fields. There's a lot of debris that's now dead and it's moldering, and that's going to be contributing to not just mold spores, but pollen. The weeds are coming up after that. And that's being distributed in an even wider area than where that original flooding area was. So it's very wide. Exactly how wide is kind of hard to say, but it's certainly beyond, all along the Texas coast where the hurricane created extensive flooding.
Yeah. Wow. It's like it just keeps piling on, kind of the issues that have come after all of this. More questions?
Yes, Lena says, my throat and head have been feeling horrible since this hurricane, and she has a strong immune system. Any comments on that?
Throat and head?
Throat and head.
So that sounds like more like an upper, so you can divide the airways into upper, which is the sinuses and nasal passages in the back of the throat kind of thing, and then there's the lower airways, really the lung. Sounds like this is more of an upper airway thing, and that could be her sinuses that are involved with either inflammation related to the pollen or the mold spores, or it could be even more serious than that. It could be an actual active infection. So the fungus can actually infect the airways, both upper and lower.
It's making me want to cough and scratch and everything right now.
Exactly.
Do we have any more questions?
Yes, a good question for parents. Mary would like to know, should we keep the kids inside until everything is clean and clear?
It's going to be so long before that happens. I actually wouldn't recommend that. Kids need to be outside. They need to play and exercise, and we have no idea when things are going to return to normal.
Yeah.
So the best thing to do, I think, is let the kids be kids, and we'll treat things as they come. I think it's probably the best way.
So Sherry just joined us, and I'm sorry.
Let me just say one thing.
Yeah.
There might be some exceptions there. Kids that have pre-existing disease or that are highly susceptible to infections, they may have a problem with their immune systems. We do have to be very careful of them. They should probably be kept inside as much as possible for at least the next few weeks. It's hard to do, but for that special case, I think we do have to be careful.
Yeah.
A lot of schools are back. That'll help.
That's true.
Sherry has a question. She joined us a little bit later. Can you recap what we can do for all of this? Over-the-counter meds, what kind of treatment if you're experiencing all these allergies?
Sure. So for allergy symptoms that are relatively benign, so for itchy, watery eyes, runny nose, sneezing, coughing, that kind of thing, there's two ways of managing that, and I recommend doing this at the same time. Antihistamines, there are several that are over the counter. The old style antihistamines from 10, 20 years ago used to make people very drowsy, but we've largely overcome that with the current medications. Yeah. I won't name any brand names, but there's several that are out there.
You know them.
And then there are nasal steroid sprays. There are at least two of those that are available now that are over the counter. Those
seem to be recommended a lot more these days. I was actually recommended one earlier this week, and I'm on the fence as to whether or not to try it. You think I should?
I think I would. And those can be very, very effective in combination with antihistamines.
I see. Okay.
There is another class. So if you have a lot of itchy, watery eyes, there are topical eye drops that have antihistamines in them.
Okay.
That can also be used. It can be very helpful.
Okay.
Okay. Susan would like to know what needs to happen to move all this stuff out of the air. Any ideas?
What can we do
that's causing allergies?
What can we do to get rid of it?
Mm-hmm.
Some of the best strategies is to dry out. And so properly remediating those homes and to cut down the further growth of mold, getting the cities getting back in operation, and getting rid of those moldering piles of debris that are coming out of those houses. That's probably the best thing that we can do. One other thing is for Don't forget about the pollens. So pollens are probably increasing in amount because of interrupted services for grass cutters and park maintenance, that kind of thing.
Oh, sure. I didn't think about it that way, but yeah.
Getting that back in line, restarting all that, just getting back to normal. Those are the best things we can do right
now.
Okay. Christine, hang in there. She says, I can't breathe. I've never had this before. Diane would like to know, should we get an allergy test?
Yes, I would highly recommend that for those that have symptoms that continue and that persist and they're not responding to the usual over-the-counter medications. I do recommend going to a specialist who can do skin testing. There are other forms of allergy testing, and that will help you understand really what it is in the environment that you're allergic to.
Okay.
And then based on that, avoidance is good, but then immunotherapy, that is shots, allergy shots, is a way of, basically a form of vaccination against the things that you're allergic to. That's the only form of therapy that is useful. It could potentially be curative of allergies.
Okay. Okay. Any final thoughts really quick before we go? This just sounds like a really big, itchy, scratchy, kind of sneezy kind of situation we've got going on that's going to last us now for years.
Yes, in some forms. In the short term, though, as soon as the first cold fronts really start coming in and start shutting down all those weeds and stopping that mold growing, things are going to get a lot better. But we're not going to have our first freeze historically until late November. So until then, this is going to be a high symptom season. And after that first freeze, hopefully things will start getting a lot better.
Dr. Corey, thank you so much. And here's hoping for some cooler weather soon so some of this can get out of here. Thank you so much for joining us, everybody.